Cox, and I'm a health economist and postdoctoral research fellow at the Menzies Institute for Medical Research at the University of Tasmania in Hobart. I'm from a small island in the Caribbean called St. Lucia, and I started off my career as a junior doctor at a tertiary institution in the pediatric and neonatology service at that hospital. My main focus was on infectious diseases, and I worked mainly with the prevention of mother-to-child transmission of HIV, both prenatally and also in infants after birth. This sort of drove me into clinical surveillance and epidemiology and working with the Department of Health. And that was my door into public health. From since then, I've worked in several areas of public health, including policy, planning, evaluation, and financing. In my last job, I worked with international donor agencies, mainly with funding health projects in the Caribbean region. And that sort of drove me to health economics, because while the funding was important for improving health in the region, it was not sustainable. So then I completed a master's in in health economics and policy at the University of Adelaide. And subsequent to this, I returned to my region to work at the Caribbean Health Public Agency. I spent 2 years there and thought that I needed to build on my expertise in the field of health economics, so decided to do a PhD, opted for a PhD. I made contact with Professor Andrew Palmer at the Menzies Institute. I focused on looking at smaller cities in Australia because I sort of like the slow pace of life, and I was fortunate to meet him, and he decided to be my primary supervisor along with Associate Professor Barbara de Graaf and Professor Hayden Walters. I completed my PhD in 2022, and I was fortunate to land 2 fellowships, the Menzies Postdoctoral Fellowship, and also a fellowship with Lung Foundation Australia, the Create Hope Fellowship, which has since supported my continued research, and as they say, the rest is history. My current research is focused on health economics, and the fun part about working in health economics is that you get to work on various topics, and it could be health economic method specific, or it could be disease specific. Most of my work focuses on economic evaluation using real world data, mainly working with national registries and also using a process called data linkage. Economic evaluation is quite important in Australia because it forms the basis of many decisions about what is funded in health. 90% of my work focuses on lung disease. In the first instance, I work in the area of interstitial lung diseases, and my work primarily focuses on the economic burden of interstitial lung diseases in Australia. This is a national project, and my role currently is to focus on the epidemiological profile, cost burden, and also quality of life of persons living with interstitial lung disease. With this, we aim to build economic models which will help with the evaluation and decision-making of innovations in care and treatment for persons living with the disease. Secondly, my work in lung cancer, which is currently being funded by the Royal Hobart Hospital Research Foundation Major Project Grant. This funding gives me the opportunity to work with physicians from the Royal Hobart Hospital, researchers from Menzies, consumers and consumer organizations to improve care, treatment, and management of lung cancer in Tasmania. Tasmania currently has the highest rate of lung cancer in Australia. Tasmanian men have the highest mortality nationally, and Tasmanian women the second highest mortality. It's also good to be aware that navigating through diagnosis, care, and treatment for lung cancer can be quite complex because you have a series of healthcare providers and multiple institutions that people have to navigate. Additionally, in the Tasmanian setting, with the resource constraints, especially with the burden at the hospitals in Tasmania, it's quite difficult for patients to navigate through this process. So our project, firstly, will look at factors that are influencing the poor outcomes in Tasmanian patients with lung cancer, investigating the health system and also individual factors. Secondly, we will look at barriers and facilitators to care. And with these two bits of information, along with information on transit times of patients from GP referral to treatment, we will sit with stakeholders, mainly stakeholders working in the service of lung cancer care, and consumers to co-design solutions around the challenges that they're currently experiencing. We will then pilot and evaluate some of these solutions, the short-term solutions mainly, to assess feasibility in the Tasmanian setting. Alongside this, we will conduct budget impact analyses to provide evidence for decision makers in terms of long-term implementation and feasibility. I think my clinical background and always wanting the best for patients drives my work. When I started working at the hospital, one of my mentors on the first day of work told me that when I'm treating patients, I should always think about how I want to be treated or how I want my parents to be treated. And that has always resonated with me. I thought by working as a clinician, I could change the world, but then I realized that was not possible. So I figured working at a policy level, then I could definitely make a difference. But I also noticed that everything related to policy had to do with dollars and cents. So that's where I am right now, creating the evidence with the dollars and cents so that policymakers can make appropriate, informed decisions about subsidizing treatments and management for patients. Outside of work, I like to recharge my social battery. I'm an introvert by nature, so I spend a lot of time at home. I enjoy reading, relaxing, and watching TV. Outside of the house, I enjoy taking long walks, so that's sort of an opportunity for me to socialize with friends. I also am a foodie, so I love eating out and also cooking, and that's also an opportunity for me to socialize with friends as well. Apart from that, I enjoy traveling and exploring new places.